Welcome to my podcast. Today I'm going to talk about another case which could show in lab 2 examination. It's a patient who come up to the surgeon and tell you that he has or she has extreme tiredness. So basically, you will start off with introducing yourself as we agreed, and double check with the patient name, date of birth, and address, and then ask the patient how all has been started. So the patient will feel that she's tired all the time, she's not in the mood to do anything, she's exhausted, irritable, irritated, feeling down, washed out. So you will ask if there is any specific time that she had noticed this kind of tiredness, and if there is any trigger or improving factors for this kind of symptom. And does it start gradually or all of the sudden, and how it's impacting the patient life, generally speaking. And also, if the patient is working, you need to ask if it impacted their work and the living status with their partner. And also, you need to inquire in order to come up with some differential. You need to ask, for instance, for some symptom of hypothyroidism, whereby the patient will have tiredness, constipation, mood change, poor sleep, feeling warm, constipation, or they put some weight gain. And also they are intolerant to cold. Also, you will ask for some symptom of anemia, if there is any heart racing, dizziness, shortness of breath, what's their eating like, appetite, any recent change in the bowel habit as well. Also, you will ask if there is any symptom of chronic fatigue syndrome, whereby they have extreme tiredness, and it's certain condition. It's existing for some time or long term, like polymyalgia, where the patient will say they have muscle pain all over their body. Also, you need to ask about some symptom of polymyalgia rheumatica, whereby the patient will have or exhibit hip, neck, shoulder pain and stiffness. So you might ask them if they can stand up from a sitting position, or if they have any difficulty in doing so. Also, you need to ask about their energy level, and ask about any recent bumps and lumps, which could point out to symptom of cancer. You will ask also about their bowel habit, and if they have difficulty passing the poo, or if it's flush in the water and stick in the water or flow on the surface, which could point out to celiac disease, and if there is any signs skin rash associated, and if those symptoms appear only after certain kind of food. So also you need to ask about if they have any, if the patient says that they have joint pain. So you need to ask about if there is any associated pain with chewing, which could point to temporal arthritis. Also ask the patient if they say their energy level is low, so you could ask how long they've been feeling so, if they are motivated, if they have any depression, wake up early in the morning, they can't sleep. Inquire about any previous upper respiratory tract infection, which could point out to Guillain-Barré syndrome, if they have any weakness or numbness in their extremity. Also, you need to ask about obstructive sleep apnea. If the patient says that they wake up in the morning, they don't feel refreshed, and they they feel all the time that they need to have a nap, and maybe their spouse notice that they snore at night. And in those kind of patients, you need to check their BMI. Mostly they are obese, they have thick neck. So all of that could point out to this condition. Also, you need to inquire about their diet, if there is any lacking or deficiency in certain vitamins like B12, and vitamin A. So all of that could be also explored. Also, you need to ask about if they have any other medical condition or any medication they are taking. Say, for instance, if patient they are taking citalopram. So this is one of the conditions which could lead to low sodium, which could lead to muscle pain and weakness. So all of that should be explored, and of course, according to the case, how the patient presented, you will direct your question accordingly, and try not to forget about some of the key factor or life-threatening condition, like for instance bumps and lumps, and any acute condition that should be treated immediately. After exploring all of that, you need to ask about the patient living situation and their thoughts and idea about what could have be the cause for their presenting symptom. You will try to, of course, after examining the patient, trying to find out if there is any underlying condition for their presenting symptom, and sending some blood investigation to explore. You need to come up with an agreement with the patient, what could be the treatment and moving forward. So you could advise about trying to move, trying to do some exercise to give to boost their energy level if they can do so. Also, if they drink alcohol, try to advise to stop that, and try to lose weight if they are overweight, and try to sleep well or stick to a sleep pattern in order to improve that, and also to reduce the stress if they feel they are stressed. So that could be by a certain breathing technique to relax them. Also encourage water intake, and you could advise about talking therapy, CBT, and also avoid some of the drinks which could contain caffeine, like tea and coffee, or the energy drinks. And also advise about the self-help and some helpline that they can approach if they felt they are not able to cope with the condition. And of course, according to the presenting symptom, you could direct and focus your diagnosis and treat accordingly. Also, not to forget about in the past medical history, inquire about diabetes mellitus, and if the patient is diabetic, if it's controlled, and if he's taking any medication, and if he's regularly checking his blood sugar. So I hope by that I covered some of the main points in tackling such presenting symptom when it appears in one of the stations. Thank you.